Exciting day today here at the station because we get to help raise funds for children, families, seniors, everybody right here in Northern BC through the Spirit of the North Healthcare Foundation, impacting so many services at the University Hospital in Northern BC because, well, we all use it, we all need it, and, well, there's no better way to support it than help raise funds through Spirit Day. We've got a special show for it today on CKPG Today.
My name is Amy Cassie, and I'm the CEO for Spirit of the North Healthcare Foundation. I always look forward to Spirit Day. It's probably one of my favorite days of the year because I think that peer-to-peer style fundraiser is just, it speaks to what makes Prince George so unique and so special. We've got a number of pieces that we're looking at bringing this year, including a liver retractor for cancer patients, a new maternal ultrasound for a new physician that's starting in Prince George, which will keep our expectant mothers here instead of sending them down to Vancouver for treatments. We're also doing door wraps for our senior citizens in Gateway for dementia patients, and that's a big one. I think that's a bit of a passion project for a lot of us. Of course, we're supporting cardiac care, which is always a big need and a big gap for us in Northern BC that we're working to close. So there's a lot of different pieces that we're working on. For our pediatric patients, we're also working on a life pack. So when our children are in crisis, this will help our teams on the ground. Every year with Spirit Day, the theme is do as much good as we can for the community of Prince George and bring as much equipment to UHNBC as we possibly can. And this year we worked really closely with our patients and with our partners at Northern Health to look at what the biggest needs are and what we can fund. Last year was a record year for Spirit Day. We brought in over $380,000, and that brought a number of enhancements to UHNBC. Most notably was the upgrades to our adolescent psychiatry assessment unit for mental health for our youth. And so they're in the progress of completing that unit and getting all those pieces into place now to help our youth. And that's just a huge, I think, testament to the power of Spirit Day and when we unite as a community, what we can accomplish.
Hi, my name is Jerry Joseph. I'm the Manager of Clinical Operations for Gateway Lodge and Laurier Manor. We are looking to make small changes in the environment for our residents. Gateway is a 125-bed long-term care facility, and we have 54 beds that are specialized for the care of residents with dementia. And over the last 3 years, we have been able to get door wraps on 34 of those beds, or those rooms, and we've been able to see a significant improvement in the quality of life of residents because these door wraps brighten the environment, make it more home-like, and also it helps wayfinding for residents. Door wraps act as a signpost, or like it helps them to recognize their rooms a lot more easier than when you do not have these on the doors. So this year we're looking at getting the other 20 rooms within our dementia neighborhood to have these wraps on, and basically to help care for the residents better. We've heard great feedback from family members and other staff who work in this environment. They've seen a huge difference, and it is definitely something that we've got a lot of positive feedback on, and hence we are looking to kind of expand it to the rest of the building as well. We've been very fortunate to have had the support of the community over the last few years now with different equipment, and door wraps has been one of them as well. And we are really looking at the support of the community to help improve the care for the residents with dementia in this community. And Gateway being a specialized facility for clients with dementia, we hope that the community will continue to support us through this initiative and through this Spirit Day. I've been working in long-term care for the last 17 years now, and I truly enjoy working with clients with dementia. I also enjoy working with our seniors, and I look forward to coming to the facility every day. I have a great team, and we have great We got lots of support from our families and clients here as well. So I really enjoy working with the team and the residents here. Once again, we really thank all the donors who have helped us improve the care for the residents in Gateway Lodge.
We work really closely with Northern Health to identify the gaps in our system, in our healthcare system in Prince George. And we look at what we think is going to pair best with Spirit Day. And then we also work really closely with our teams to find out what their passions are, what makes sense for them to fund. I think that's something that really is unique about Spirit, is that you can really dive into the area that you're most passionate about and really make improvements to healthcare at UHNBC. And that's something that Spirit Day does just so well. So we've actually got a new physician that's starting in Prince George. She's from BC Women's Hospital, and so she's relocating up to Prince George. But she is bringing a maternal service to Prince George that we don't currently have. So when a mother is experiencing maternal abnormalities, she would go to a specialist. Well, now we've got that specialist local in Prince George. She'll be able to use this ultrasound to decipher what's happening with the baby, and really aim to keep that mom here instead of sending her down to Vancouver. And I think we can all relate to, it's stressful when you're having kids, and then to know that, they need extra care is definitely adds more stress to that situation. And the more moms that we can keep here close to family, close to friends, that's the best for the North. And so this is a big piece, big price tag on it, but we're really excited to fund it and bring it to the North. Amniocentesis will be one of those procedures that we're able to do locally now with the addition of this ultrasound.
Hi, I'm Dr. Elise Lapointe-Lebel. I'm the new maternal fetal medicine subspecialist here at UHNBC. I didn't have obstetrics on my radar at all as a medical student. It was my last rotation of clerkship, and then I just fell in love with obstetrics. It's such a privileged time to be involved in women's care. It's just so very gratifying to be part of their care when they're building their family. And then the maternal fetal medicine part is, it just feels very rewarding to be able to take care of women in situation that can be potentially very difficult. So that's causing them a lot of anxiety when they have a concern about their baby. And so I feel very, very privileged to be involved in their care at that time and be able to reassure them and take care of them and provide the care that they need. I did my 5 years residency in obstetrics and gynecology. And following that, I did an additional 2 years fellowship in what we call maternal fetal medicine, which essentially is taking care of high-risk pregnancies, whether it's for mom's reason or for baby reason. It's a specialized ultrasound that's really, really good for obstetrical ultrasound. It is similar to what they have at BC Women's and in Fraser, although I'll be the first one in Canada to have this one new update of the system. So it allows me to do kind of more in-depth evaluation of the baby. I can do specialized fetal echo, so that's the specialized ultrasound of the baby's heart. I can also do 3D ultrasound, 4D ultrasound, which is not possible with the machine that I have currently. Because right now, any family that needs to have maternal fetal medicine care has to go either to BC Women's in Vancouver, to Surrey, or in Victoria. Already, we've only been 3 weeks in, and every patient that I've seen would have had to go to Vancouver to have care. So it's really significant for families to be able to stay locally, and also it can be so expensive for them to go all the way to Vancouver. Having this capacity here to scan them allows me to get those pictures and then potentially just take care of them here until they deliver, rather than them having to go to Vancouver and then come back, or go to Vancouver and have to stay there to have their whole follow-up. is it's going to make such a difference in the life of so many families in the North. Having this care here is, as you said earlier, it's life-changing. And there's so many families who have tight finances, they just can't go to Vancouver. So a lot of families would actually not even get the care that they need. They would rather stay here and not go to Vancouver. So they'll be able to have the care that they need and the care that they deserve. Maybe it's the start of a growing program. You know, maybe in a few years, we'll be able to hire another maternal fetal medicine to work with me, and potentially a nurse. The favorite part of my job would be to feel like I make a difference in women's life and in women's care.
Really exciting this year, we've got our Copper Project. So the Copper Project team has decided that they want to take those funds and match donations. So every donation that comes in with Spirit Day will be matched by the Copper Project, which is absolutely fantastic. So a $20 donation turns into a $40 donation. And I think that just speaks to the passion of our community to really close these gaps in care and help our families and friends. And so a big thank you to the Copper Project and everyone that's a part of it. We're really excited to bring them into Spirit Day and have them be a part of this great day.
Miss an episode? That's okay, life gets busy. We get it. Or maybe you didn't miss anything, but you're here to watch that one feature again because honestly, it was that good. No judgment. Here's the good news. You can relive every moment of the CKPG Today show whenever you want. Head over to ckpgtoday.ca, click on the Today Show tab, and voila. So grab some snacks, kick back, and binge away because let's face it, life's too short to miss out on great local TV.
The liver retractor is a very specific piece of equipment that'll be used for various surgeries for instance, cancer patients that have liver cancer, pancreatic cancer, for Whipple procedures. We've actually got 2 new surgeons starting in Prince George, so this will be a new service that's being offered to our community with the liver retractor. So it'll be done for liver resections, which, you know, you see a lot of cancer patients that need liver resections, either from liver cancer, colon cancer, pancreatic cancer, those type of things. And this allows for that surgery to take place locally in Prince George. It's a really interesting piece, one that we're really happy to bring to Prince George because I think the need is there definitely.
Hi, I'm Amanda Millen, Manager of Clinical Operations, UHNBC Perioperative Services. So the liver retractor is a surgical instrument that allows the tissues, organs, or anything else to be moved out of the line of sight so that the surgeon can really focus on what they're working on during the operation. This will be very beneficial for cancer surgeries of bile ducts, gallbladders, liver, as well as some of the procedures we already perform here, such as Whipple procedures, which are all cancer-related surgeries. The liver retractor will be one of the surgical instruments that we have at UHNBC to start this program. So right now we do not have a hepatobiliary program here at UHNBC. We have a new surgeon that has joined us who is specialized in this, and another one that will most likely be joining us in the summer. And so they will really benefit from using this piece of equipment. It is what they've trained on down south at larger facilities. It is what larger facilities down south use. And so it'll just help us continue that care in the same way that you would be receiving at a larger center. So this is the liver retractor. So you can see that there's 2 arms that attach to the bed for stability. And then we have the arms that go around. These are blades that can attach to any of the arms around it. It allows for better access, and some of the blades are even malleable, so you can move them in whichever way you need to really get around and visualize what you need to. We want to have the northern populations have the same access to care that you would in a larger city or a larger facility. It'll allow patients to stay closer to home where their support system are, and have these surgeries, these complex surgeries, in their home communities instead of having to travel very far distances with very limited support systems to join them. My favorite part of the job has been working on projects that increase access to surgical care for our patients in the North, and seeing the data that comes out of that and the results of patients being able to be seen quicker and have more access to surgical care has been the most rewarding part.
We're going to hear lots about cardiac care for the next number of years. Cardiac care remains one of the biggest gaps in care that we see in northern BC, as well as in Prince George. And so while we've done a lot of work to help close that gap, there's still lots more work to be done. So we're working with our outpatient programs to make sure that they've got all the equipment that they need to treat our cardiac patients at home, keep them out of the hospital and treat them at home. So there's a lot of different pieces that we're working on with those outpatient clinics. And then I think beyond that, cardiac care remains that big gap that cancer care was for so many years for the North. And so our aim is to bring that full level of interventional cardiac care to the North. So you'll see lots of work happening over the next number of years to gear up for that. It's a big piece that we're missing and that we need to close. We worked really hard over the past couple of years to equip the first cardiac care unit at UHNBC. So that was just over $1 million in funding. That is now operational. And so now they've got the equipment that they need there. But as that service and as that department continues to grow, there will be more and more need for equipment for that team as well. So we kind of blend between the outpatient and the inpatient teams to make sure that they all have the tools that they need in their hands at the times they need it most. So this year's monetary goal, we would love to see it over that $200,000 mark. I mean, that's a huge number to raise in 12 hours. So that's really our goal. But ultimately, our goal is to fund as many of these pieces as we can and bring that care to our community in the North. I think our message every year is thank you. Prince George never ceases to amaze with what we can accomplish when we all unite. And we just lead with thanks. Thank you so much for helping us close these gaps, for seeing the need, seeing the value, and knowing that every dollar that comes in with Spirit Day stays local, it stays here at UHNBC, and it directly supports our families and our friends locally. And I think that's a really big piece that we can never say thank you enough for.
Taking a look outside of today's CKPG Snapshot. This one comes with a bit of a story from Ann Spears here. You see a beautiful close-up on I'm going to say a friendly-looking porcupine, although that may not have been the experience that Ann had with it. Well, let's tell you about it. Okay, so Ann was driving along, saw this animal in the ditch, went over, grabbed the camera, and while the animal turned around, showed its rear to Ann. Well, yeah, no verbal communication needed there. Everyone knows what that means. But then Ann kind of calmly backed away and gave it some space, and look at that. It even gave her a bit of a smile. Thanks so much for sharing. If you have a snapshot, send it our way. snapshot@ckpg.com. Hey there, got an idea or suggestion for the show? Reach out and connect through our social media or send us an email at letstalk@ckpgtoday.ca.
You know what? Some people like Jim Swanson. He used to work for the Prince George Citizen here. Other people, not so fond of him. But the one thing I think he might have had right here, when you're looking back today in history, was an editorial he did on the Cougars potentially retiring some jerseys. Now, we've heard the conversation come up again. Cohen Zemer, Riley Heidt. But let's look back at another discussion at some great Cougars in local history today.
Taking a look at a discussion in 2002 by the well-known Jim Swanson, of course, retiring Cougars jerseys numbers. He thought they should retire Dan Hamhuis's number. Why not? Nobody else should wear number 5 for the Prince George Cougars ever again. Well, fast forward, they didn't retire it, but you could argue we're having some of the same discussions nowadays with the likes of Riley Heidt, and Cohen-Zemer, should they be retired? A cool little look back in local history here at the merits for the reason for retiring Cam Hughes' number. You could argue lots of the same merits come up in today's discussion.
So yeah, if you're the Cougars, who do you retire first? Cam Hughes, Brewer, Chara? Do you start with the Zemer Height era? I don't know. So many questions, so many options. It's just like your donations for Spirit Day. There's a lot of options there. Pick your passion, see what you can support. And hey, all the funds raised stay right here in Prince George and Northern BC. So you can feel good about that. Thanks so much for watching today, folks. And don't forget to support Spirit Day and the Spirit of the North Healthcare Foundation. We'll see you for more great stuff on the show tomorrow. Bye for now.